work, or just too fixated on D.C. to notice much of what they are doing. Joining us now is Dr. Zeke Emanuel. He's former White House advisor on healthcare policy, he's now chair of medical ethics and health policy at the University of Pennsylvania. Dr. Emanuel, thanks for being here.
Thanks for having me again.
Why is it important from your perspective that states do expand Medicaid to cover more people?
So there's a health reason, which is this is the poorest people in the country that are being excluded. They're people who earn under 138% of the federal poverty line, roughly for a family of four, about $27,000, $28,000. So they're poor. They need health care just like everyone else, and they're being excluded. And they're typically working people. They work already, but their jobs either don't have health insurance or don't pay enough so that they can purchase it. And Medicaid has been the solution for that problem.
What is striking because of that, because of the people who we're talking about being most affected, who are in most need, who are being most affected by this campaign, is to have these incredibly rich guys
who inherited their money, by the way, did not earn it.
Who inherited, they've done a lot with dad's money, but they got it from dad. To see them ideologically campaigning in a very effective way, state to state, and really funding the lion's share of these efforts to keep poor people from getting health insurance. Is it an economic interest to them in their business concerns, or is it an ideological argument?
Well, it's clearly an ideological argument on their part. In most states, it's also an ideological argument because most states, like Ohio, stand actually to benefit net on their budget from expanding Medicaid. And here's how that works. Right now, there's a hidden tax on states who have to provide health insurance to their state workers, their legislators, or cabinet members. And in that money is money to pay for uninsured people who go to hospitals and use services. That will decrease. Similarly, most states have a way of compensating hospitals who take care of the uninsured for the expense. That'll decrease if you have Medicaid. And the federal government's picking up 100% of the Medicaid bill for the first 3 years, and it drops down to 90%. So it's estimated that more than $13 billion will go to Ohio, for example, and it'll change their budget over the next 10 years by about $2 billion added to their budget because of these decreases in state insurance expenses and support for hospitals. So from a state budget perspective, this is a winner. So it's economically rational to do. The only reason not to do it is ideology.
And so, even the dimmest governor can add numbers that big in their head, probably. Seeing John Kasich resist members of his own party that tried to force him to not expand Medicaid, seeing him go ahead and do that anyway, seeing a number of other Republican governors making noises that they're being dragged to it, but doing it anyway. Do you think that ultimately, as states start to do this, it becomes a matter of competitive advantage that more states will have to?
Oh, absolutely, because it's going to be better for their budget and therefore for their bond rating and borrowing money. Yeah. It's also going to be better for companies in the state to know that they have a stable health package and to know that the premiums are down because of things like competition in the exchanges, et cetera. So I think actually states that do a good job on this are actually going to see more businesses come in, and businesses want to work in those states. I think this is, I've actually predicted that by the end of the decade, all the states are going to be on board because it makes so much sense. Again, a lot of this is driven by the next election and probably the presidential election in 2016. Once those are over, states are going to see the economic rationality.
We're seeing so much of a patchwork, both in terms of whether or not states are expanding Medicaid, which has a huge impact on the number of people with insurance in the states, but also on whether or not the exchanges work and whether they work well and whether or not they're being well promoted in the states. In states where it doesn't work well, where the number of uninsured isn't dropping and the number of people having easy access to more affordable care doesn't go up very quickly because the states just aren't doing a good job by hook or by crook, does that adversely impact the effect of this law at making health insurance more affordable in states where people are trying to make it work?
Probably not. So I think actually we're going to have an interesting natural experiment. California has gone full steam ahead with expanding health care. It was the state with I think the third or fourth most uninsured people. They have a very good website, easy to shop on, very good pricing, lots of companies in there. They're expanding Medi-Cal very vigorously. And then you're going to compare them to Texas, which has the most uninsured people, which has been resistant to everything under the sun. And we're going to see what happens to health insurance premiums premiums in those states, even for the insured people and for businesses. We're going to see what happens to the health status of everyone in the state. And I think we're going to have this experiment where California is going to show that really doing it well and doing it properly is much better for the state and going to be much better for the state economy. By the way, the more competition there is in the exchanges, the more they bring premiums down, the better for employers who are offering insurance, the better for everyone else. So there's an important dynamic here where the more people you get into the exchanges, the more people who shop or have Medi-Cal also is going to benefit all the rest of us. And I think that's something that hasn't been fully explained to most people. Texas, I think hospitals are going to hurt there because they're still going to have a large number of uninsured. And I think a consequence, people are going to see their premiums not come down.
That, from a policy perspective, from sort of a wonky perspective, that comparative natural experiment is going to be fascinating to watch. It also makes me feel like if I was watching this from Texas right now, I would think, boy, I'm not sure I want to be that guinea pig. We shall see. Dr. Zeke Emanuel, former White House advisor on healthcare policy, now at the University of Pennsylvania. Thank you for being here.
Thank you.
Appreciate it. All right.